In this video, I'm going to go over what to expect on the day of your Stapes surgery. Typically, a Stapes procedure is done to try to improve hearing when you have a condition called otosclerosis. This condition causes the small bones in the ear that conduct sound to stiffen. That decreased movement causes hearing loss. The good thing is that surgery can often improve your hearing by repairing the fixed Stapes bone. On the day of surgery, you'll report to the surgery center or hospital where your procedure is scheduled. You'll be checked in, and then a nurse will review your medical history, go over routine pre-op questions, and place an IV. After that, you'll have a chance to visit with your surgeon, who will go over the surgical plan with you, answer all of your questions, and make sure you feel comfortable moving forward. Then the anesthesia provider will visit with you and talk about the type of anesthesia you'll be having and what to expect from that as well. The anesthesia provider will then take you back to the operating room. You'll move yourself over to the operating table, lay your head on a pillow, and breathe some oxygen. While you're breathing the oxygen, the anesthesia provider will give you medications through your IV, and you'll fall asleep. When you're asleep, the anesthesia provider will place an airway to help your breathing during surgery. And this can be through the vocal cords or above the voice box with a supraglottic airway. That will be decided by you and your anesthesia provider before surgery. Once you're safely asleep, the ear being addressed will be prepared with a cleaning solution, and you'll be draped with towels and sterile drapes. Surgery is then performed through the ear canal to repair the bones of hearing. When the surgery is complete, the anesthesia provider will turn off the medications and you'll wake up. Once you're awake enough, the airway will be removed and you'll be taken to the recovery area. While you're in recovery, your surgeon will speak with your family, explain how things went, and give any specific instructions for your recovery. You'll stay in the recovery area with nurses who monitor you closely. When you're more fully recovered from anesthesia, you'll be reunited with your family. You will then receive instructions about wound care, home medications, and activity restrictions. Typically, after Stapes surgery, you are asked to have only light activity for a couple of weeks. And specifically, you are asked to not bend, stoop, or strain. Then you will be able to go home with your family. That's what to expect with Stapes surgery. Now you know. Thanks for watching.